Hello, everyone, and welcome to Health Law Talk presented by Shahardy Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
All right. Good afternoon, everyone, or good morning. Rory Belina in the studio today. Conrad Meyer, another edition of Health Law Talks.
Afternoon, everyone, or good morning, depending on where you're listening.
All right, and this is sort of a special edition, I guess, very timely, another timely podcast on a previous podcast we did on vaccine mandates.
Yeah, so today's topic is going to be OSHA's emergency temporary standard. It was announced last week by President Biden, and it's going through a little bit of an administrative period, but we expect it to roll out shortly. And we know we've already getting calls on it from some of our clients, so we thought it'd be a good topic for today's episode.
Absolutely. So, well, first off the bat, what is an emergency temporary standard? What is that?
Sure. So if you're not familiar with what an emergency temporary standard or ETS is, we had one come out, I believe it was earlier or later in the year, last year.
It was June. It was June.
Okay.
Of this year, actually.
Yeah, you're right. The years are blurring together, but it was
That's what happens when you get locked down, right?
That one was for healthcare workers, and basically it's the government takes authority under OSHA to put in these emergency standards, and there's kind of this two-pronged criteria that they rely on, one being that there's a grave danger and that there's an emergency standard necessary to protect. So we're going to dive into a little bit of what that looks like and how this power has come to be and how it was used for healthcare workers and how now it's going to be used for employers of 100 or more. So we're going to talk about those different criteria as well.
Now, for those of you who are the legal eagles or who like to research and dive right into it, you can find a lot of this stuff online. The citation for the ETS that was adopted in June, 29 Code of Federal Regulations, Part 1910, Subpart U. And you could check out 29 USC, United States Code 655 C1, to see the emergency standard or the emergency temporary standard that OSHA must meet. So for those of you who like to research, that's there. Sure. We're seeing on the news every day, very unpopular with some folks, very popular with others. Rory, what hurdles do you see coming up? How about this? What challenges do you see for OSHA with respect to mandating this and maybe relate it back to the healthcare one that was done in June?
I see a few, and we see more and more employers are getting together or unions are getting together to challenge this. So, I think it'd be beneficial to our listeners to give a little bit of background of, what OSHA is, what this ETS is, and kind of walk through.
That's a good idea.
How this is going. So,
yeah.
Over the 10,000 foot view is that, OSHA is this administration that was put together by the government and stands for Occupational Safety and Health. So they're the agency that essentially regulates a lot of work type requirements, rules, regulations. So you take a construction site, for example, OSHA says that you have to wear a hard hat or a certain color neon vest. If you work hospital, for example, if you mop the floors, you have to put out the little slippery when wet cones. And the goal behind it is to have this standardized set of rules to where there's workplace safety. And so your employees are safe and people that are on the premise are safe. So that's kind of what OSHA is. That's very loose description of what it is, but that's what it is overall. So Conrad, I know that you and I have looked into this, but OSHA took their power and mandated allowed the vaccinations to be required for healthcare workers earlier in the year.
And that was back in June of this summer, and they used the grave danger language to give them the authority to do that to healthcare workers because of the COVID numbers, and especially with the rise of the Delta variant.
And you mentioned the grave danger. So, like we said, OSHA has these rules and regulations that I gave the example of, the hard hats, the neon vests, the slippery when wet signs. But that typically takes...
That's just for regulatory stuff. That's just regular everyday operations.
It does. And to get those rules into place, a lot of it takes a lot of time takes public comment. It's a slow process.
So wait, real quick, let me stop, pause, hit the pause button. Let's, for our listeners, tell them what normally in any kind of rulemaking situation from the federal government, from an agency of the federal government, how does that, from the, again, 10,000-foot view,
right,
how does that look? What does that look like for the layperson so that the people can understand how rulemaking occurs from an agency standpoint?
Sure. So it typically will start with an agency or, a group of members within the agency, or they'll get suggestions. So I'll go back to the hard hat example that we keep going. Someone says, or someone within the agency says, look, if you're on a construction site of this size or of this specification, everyone should be required to wear a hard hat. So they have that general policy in place. So OSHA will look at it, and they will look at it and say, okay, we think this is good. Let's see, what kind of hard hats are we going to mandate? Do they have to be a certain strength, a certain quality? And then let's go to the public. Let's open this up for public comment. So that's when you'll get people from different industries, whether they're
So there'll be a preliminary rule.
Correct.
And then it'll be published on the website or in the internet.
And there's a period of time where they allow for public comment. And the public comment period allows people that are actually on the ground saying, this rule is ridiculous, that it's going to slow down productivity, or these hard hats are too expensive, or the manufacturer can't get us to them. So it gives time for the government agency to work out the wrinkles. And they'll take all those comments and they'll respond to them typically, and they'll say, okay, well, here's our interim rule, and they'll put into place another rule, and there'll be a period of that time. And then ultimately it goes up the chain of command and gets approved and put into a regulation. And so,
or a final rule.
A final rule, correct.
Right.
And so that's kind of the outline of how these rules come into place.
Now, in a normal situation,
what's
the process from, let's say, preliminary rule all the way through comment period, interim, and final? What would you say that?
From what I've seen, I mean, you're lucky to get it done in a year. From these rules that I've seen, it's a slow process, because it goes from we're going back to the hard hat example. It goes from one agency to another. Then they'll talk about the engineering side or the design side. It bounces around between agencies. Then they'll do public comment for typically at least 60 days. They might make some revisions. It has to be published. It has to be noticed. It's a very slow process.
And when the final rule is published, how often does it take, or how often does the agency, and I guess it varies by agency,
sure,
but do they normally give entities to comply?
Like a grace period, yeah. So typically there's a grace period, and depending on when the final rule comes out, a lot of times it's 6 months, or it could be the beginning of the next calendar year, where they say, okay, here's the new rule. If you're on a work site, you need this hard hat, but we're not going to make it effective until January 1 of next year.
So it's sort of a lengthy process.
It is. It's very lengthy. It's very bureaucratic. It takes time to go through to get these put in place.
Guess how long OSHA gave to implement, even on a comment period, the emergency temporary standard for the healthcare workers back in June?
I'm not sure. It's a good question.
That's a good question. 15 days.
That's ridiculous.
And wait, it was 15 days after publication. There was hardly any time for comment period, and then and that was not just for comment. That was for compliance.
That's very short. And just to go into a little explanation of why that shows short is, when these rules come out, they're very complex and they're very detail oriented, and a lot of them have very, minute criteria in them.
I get that.
It takes time for your agency or your attorneys or your lobbyists to look at this and say, this isn't going to work.
But if I'm a hospital,
you've got no time to.
You have zero time to respond to this,
right?
And then not only that, I know that some entities were allowed 30 days, others only 15 days. So now we have this next on the vaccine mandate for the 100 employees or more that's coming out using the same criteria under the ETS. On this, quote, grave danger. And again, I mean, think about just those two words, grave danger. What does that mean? How is it defined? Do we have any case law that will discuss that? And you know what they're going to do. They're going to parade all the COVID numbers, all over the place from the Delta variant, from the day this started. And they're going to say, see, everybody, this is a grave danger.
And there's two criteria that you mentioned. It's that employees are exposed to a grave danger from substances or agents determined to be toxic or physically harmful, or from new hazards, and, big word, and that such emergency standard is necessary to protect employees from such danger. So I think you really have to break those apart and say, okay, the first thing, is COVID-19 considered a grave danger? I think you'll get people that can rightfully so argue that on both sides. They could say, yes, it's causing hospitalizations, deaths, complications. It is a grave danger. I think you can also find people to say it's a danger, but we have vaccinations, we have the social distancing protocol, we have masks in place, we have ways to fight this. Is it grave enough to take this sort of action? So, and we'll kind of walk through this, but essentially the government is saying, yes, it's a grave danger. So we go to step 2. This is necessary to protect employees from such danger. And those are the 2 criteria that are going to be the basis for the challenge. I think the grave danger is going to be the one that's challenged more, that this might fall on.
Well, I guess the next question is when you're looking at the data that's going to be thrown on the screen by OSHA, and whoever's defending OSHA on this rulemaking, what is that data accurate? Where did they get the data? I mean, since this whole thing started, I've heard so many different things about how we collected data.
Sure,
what's counted as a COVID death? What's how do we monitor and collect COVID positive tests?
Right,
and it's all changed from day one until the present. So it's constantly changing. It's to me, is it really accurate?
Right, and you can get these data sets and make multiple conclusions from what you see in them. So this is definitely going to get challenged. Is it an ETS? So I think for the conversation of this podcast, let's just take it where it is right now. It's coming out. It's going to be challenged, obviously.
Well, they haven't issued the rules yet. There's not even a preliminary rule yet.
But I think it's important to talk about, let's assume that this goes forward and is finalized as is. So what would happen? So first of all, who does this apply to?
Well, and that's a good question because, it applies to the 100 employees or more.
Correct. Public or private.
Public or private. But also you would figure it applies to every state in the land, but there are states already that have state mandated rules.
Correct.
So with these states, to me, it's kind of going to be like a HIPAA situation. Remember HIPAA?
Yes.
So if the state rule is similar or more stringent than the OSHA ETS,
that applies.
Correct. And then if not, then
OSHA applies.
Then OSHA ETS applies.
And I think an important thing to point out, especially with so many people working virtually and working from different locations, is that this rule was very clear and it said that it's not location based. So if you work for a branch of a bank or a branch of or some entity like that, as long as your entity has 100 or more, this applies to you. Even if you have if you're in the little office in New Orleans that has 5 people, but New York has 1,000, this applies to you.
So let's take fast food for example.
Sure,
franchisees, right?
Yes.
Or even they might have different entities, right?
Right.
Does that collectively get added because they're all a certain fast food franchisee? I mean, does it collectively? I don't know.
And I don't think we know. I think that's a corporate criteria question. We don't know because the franchise model is a great example. There's a lot of franchises, and if you have 5 employees underemployed under your LLC, but you're ultimately under the umbrella of a corporate franchise, does that apply to you? It's unclear right now.
Well, I guess another thing too, Rory, that kind of gets me is well, okay, so what's the message we're sending here? Basically, what we just talked about before the show. Basically, no matter what happens, it's going to be like everyone's getting the vaccine.
Correct.
I mean, that's the boxing in. Somehow it's going to come to that.
I think we're seeing as days and weeks go on and on. It started with the goals to get the healthcare workers, the elderly, and the teachers vaccinated.
Now, if you would have talked to me, we did the show 6 weeks ago on the vaccine.
I think so. Yeah,
4 to 6 weeks ago. Was it middle of August?
Yep.
Or beginning of August?
And we didn't have. This wasn't out, and we were talking about, could it be mandated could it be mandated? And
now we know the answer.
Yeah. And I think as time goes on, you're going to keep seeing as I don't want to say vaccinations are at a standstill or anything like that, but as vaccinations aren't getting to the numbers that the government wants them to be at, you're going to see the government finding these creative ways to mandate more and more Americans to get vaccinated. And this is probably going to be the biggest swoop. If you're trying to get, a huge chunk kind of in one rule, I think this is the one that's probably going to accomplish it the most.
With the exception of the Postal Service, right?
Right.
And guess what? Did you realize? And the Congress?
And Congress.
Yeah. And the judicial branch as well.
Yep. There are some carve-outs to this already, which
I wonder how that played out.
That could be another topic for another.
That could be another topic for another show.
But it's got some serious implications, and they break down violations. If you violate it and and it's not really defined, but a serious violation could be $13,000 per violation, or a willful violation is $136,000. So you're talking real dollars that could cripple a medium to large sized business with 100 or more employees.
That's per violation.
Per violation.
So I guess the question is what's considered willful, right?
Right. And if you have a company and you say, I'm not going to follow this OSHA ETS, what happens? Does that mean that every person that doesn't follow it, that's a willful violation of $136,000?
Do you think the government, we haven't seen the rulemaking yet, but is it per individual? So if I've got 500 employees and we're saying we're not doing it, is that 500 willful violations?
And I think that's a question that would come out in the comments, but OSHA has already said that they're not going to provide an opportunity to comment on this, which is, I don't know if that's ever happened before. It seems very strange.
I have never, in the rulemaking thing, and you and I have been doing this 20 plus years in healthcare.
Sure.
I've never seen a rulemaking like this where the trigger was so fast.
Sure.
And there was no comment period.
Sure. And I think it comes down, it continues to develop. So if you're the employer, now you have to follow this rule. Or you have to have weekly testing. Let's talk about, one thing in there is that the requirement says you have to provide reasonable paid time off for the vaccination and for side effects. So imagine you're a huge corporation and you need these employees available. Now they have to get vaccinated or tested weekly, but if they get vaccinated, they get paid time off to get that vaccine and for those side effects. You're going to have to really be creative in how you schedule your employees to get vaccinated so you have staff to continue to operate.
Well, again, and I think and I think the president came out and said that it applies to 100 employees or more, but it was either get vaccinated or have that weekly test, right?
And we don't know who's going to cover the cost of the test.
Well, we got who's going to cover the cost of the test. Mm-hmm. What evidence do you have to show that you had the test?
Correct.
What evidence do you need to show that you have been vaccinated? Aside from your vaccine card, what else? What else do you show?
Right.
And then. So there's a lot of things in limbo that we just don't know because we haven't seen the rules.
Yeah, I think that this ETS has brought out many more questions than we have answers to right now, and I know that I've already started to get questions on it, and a lot of it is we don't know until the final rule comes out. We don't know what it's going to be.
So if you're an employer that has more than 100 or more employees, these questions have got to be burning in your head. If you're not going to force this on your employees, mm-hmm. then who's going to pay for the testing? How are you going to schedule that? Just to comply with the ETS. So
right.
I think a lot of questions still outstanding on what I've seen is warp speed on this ETS.
And there is allowance for medical and religious exemptions. But then that's going to require that weekly testing. So you could have a significant amount of your employees that need to go get tested weekly, that they're losing time in the office. The costs associated with the testing, which we still don't know who's going to bear that cost. So like you said, there's a lot of unknowns with this. It's going to be interesting to see how employers and big unions, want to handle this.
Well, I think from what I'm reading, they're going to wrap the healthcare ETS that was done in June into this. Right. And so, recommendations that I think employers need to figure out, number one, are they going to comply with this or not? That's the very first thing.
Sure.
How do you deal with people who work remotely? So, in other words, if you've got a sales force that's out all over the country, all over the globe, how are you going to confirm a COVID test from someone who's not, local?
Or what if you're a large company but a huge portion of your force work from home? Are they going to be required to get a vaccine when they never step foot in an office?
So then what about how to identify unvaccinated and vaccinated employees? How are you going to do that? You're going to line them up and say, show me your card?
Or now you're going to have to start asking for medical and religious exemptions. So you're going to have to ask them, show me a doctor's note that says why you can't get this, or tell me your religious reasoning. And that's very personal information.
What about, a compliance officer? Someone, you're going to have someone in compliance regulate, some sort of policy and procedure for just getting the testing results.
Right.
So that you're complying with the ETS.
And constantly tracking it, and everyone's week is going to fall on different times. It's not like you can just do all these on a Monday. It has to be a week from the prior test. So it administratively, if you have a large company and your employees are not all vaccinated, it's going to be an administrative hurdle for you you're going to have someone that's very dedicated to this, to dealing with this testing.
And then again, other things too. If you're going to are you going to pay for the vaccines? You can have on-site vaccination clinics. Right. You can have on-site testing.
Right.
How do you set that up?
One thing that the ETS does not address is what is considered vaccinated. Is it one shot? Is it two shots? Is it 2 shots plus 3 weeks when the shots are most effective? That's unclear as of right now too.
Nobody knows that. That's true.
That's another thing that's vague in this.
So what do you do with employees who don't want to do this? What's the option? We saw the Texas case, right?
Right.
Where, that was national news, but I'm
Sure.
sure it's happening all over the place where people are just getting fired. Is that the answer?
I think the employer is going to have to make the decision. Are they going to, the employer could be more strict. The employer could say, we're taking this OSHA guidance, but we're going to make it stricter. We're just going to say vaccine or bust, vaccine or you're out. And that could be that because I could see employers looking at this and saying, I don't want to deal with the testing portion, and I don't want to have to pay someone to just be a manager of COVID tests. I'm just going to make it you're either vaccinated or you're not an employee of this company anymore.
So messages to employers, from my standpoint, just from listening to this and watching this from a very, very important,
Sure.
eyes wide open gaze
Sure.
here. I think employers need to absolutely monitor the OSHA guidance to keep up to speed as to what they're going to do, and then also look at the CDC guidance.
Yep.
See if they correlate, with this correlation to that, and keep on top of that. And also, now because this has come from the White House, you're going to have to monitor the executive order,
Right.
And what is coming from the White House to determine what are you going to need to do to comply. So because that's going to feed into OSHA and then the CDC, all of them combined now.
Yep.
You have a lot more eyes on to see if you're going to comply with these new ETS standards.
And it's going to be a conversation that you have to have with your upper level management and owners to decide how do you want to handle this, what policies do you want to put in place. It's ever changing. I think we're going to have to do an update on this in a few weeks when we get this final rule and we could really dissect it.
Absolutely. And look, I want to thank everybody for listening today. This has been a special edition of Health Law Talks with respect to the ETS that's going to be coming out from OSHA real soon. We want to thank everyone for listening. Please go ahead and make sure to subscribe to our podcast channel. You can do that anywhere on Apple Podcast, I think on Spotify, and tell us if you have any comments or if you have any questions or if you really want to just ask us to do certain topics. Why don't you go ahead and give us an email? I'm going to leave you my email. It's cm@shahardy.com. Rory?
rbellina@shahardy.com.
Send us an email if you like us. Tell us what you think. Tell us the good, the bad, the ugly. And if there's some topic you want us to hear or talk about, please put it in the email. We look forward to hearing from you.
Thank you. Thank you for listening to Health Law Talk presented by Shahardy Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. Thank you for listening.